this is for you, because it's easy to start with a case report. It's easy to start with an ophthalmic image than to do a prospective or a retrospective study and then publish that. So if you can take one message from my whole talk, it is this: photographic documentation. If you forget everything else, it's fine. Just one message from the whole talk, it's this: photographic documentation. So basically, ophthalmic images and case reports, you can have it as a cover image, or as a short report, or as a case report, detailed case report. So cover image, if you can take one visually striking image, then you can submit it to certain journals. So like ophthalmology, ophthalmology glaucoma, ophthalmology retina, eye, Canadian Journal of Ophthalmology, and now recently IJO by invitation. That is, they conduct competitions, and whoever wins, that image will be taken care of. So this is my image on pellucid margin regeneration, got published in ophthalmology. How do you submit? You just write a mail to the editor saying we are pleased to share with you a slit lamp image of this. I use this machine to take it, and these are the people who needs to be acknowledged. The institution affiliation is this. That's it. And it will go to the editorial office. If they like it, they'll accept it. If they don't like it, they'll not accept it. So this is an image of Descemet's membrane anomaly with a diffuse and a direct and indirect focal illumination. The problem with the cover image is, in a issue of any journal, you have around 25 to 40 articles, but only one cover page. So getting accepted as a cover image is slightly difficult. For every image that is accepted, we have around 10 to 15 good photographs which are not accepted. But you can always try. At the max, they are going to only reject it. So, and now ophthalmology has come with a criteria, like for a group of individuals, they will accept only 2 images as cover images. I already have 3 in, so I can't submit any more in ophthalmology now. So the next part is short reports or abridged report. So you have pictures and perspectives in section in ophthalmology. You have ophthalmic images section in JAMA, and in IJ you have ophthalmic images and photo essays. So pictures and perspectives, here again you need good quality photographs. You can also include photographs of CT scans, X-rays, the histopathological sections, microbiology slides, culture. So what you're going to publish here is something new or something unique. So you can have up to 4 images, and you just need to write 100 words legend. You don't need a reference, you don't need a literature review. So it's slightly easy to write, but difficult to get published. And they allow only 3 authors. This is an example from a patient of agarrosis, that is a silversmith who had deposition of silver in the cornea, conjunctiva, slit lamp image, and in the nails. So here it's just a legend describing these images and one line about agarrosis. That's it. And sometimes you may not get one good image to depict the condition. So you can use multiple images to depict one condition. So here there is a tube in the sulcus in a phakic eye. So there is a slit image which shows the lumen of the tube, the cornea section, the lens section. But again, the lens, that the fact that lens is clear is not mentioned, could not be seen here. So you take a retro illumination image, but again you can see because of the iris, you are seeing the tube here, and the lenses appear to be clear. To our surprise, this got accepted in ophthalmology glaucoma. But sometimes, so at the max they can only reject. So always submit. So to give a few examples of last month's ophthalmology pictures and perspectives. So they have post-cataract surgery, orbital conjunctival inclusion cyst, choroidal metastasis of retroperitoneal mucinous cyst adenocarcinoma, corneal melt after implantation of a ranibizumab implant, conjunctival spindle cell sclerosing rhabdomyosarcoma. So whenever you have a histopathology, the chance of it getting accepted is higher. The next section is in JAMA ophthalmology. They have a slightly more words, 150 words, excluding the legend. So here you can have some references. So you need to give a small literature review. Again, here they allow only maximum two images, not more than that, and less than 6 references and 3 authors again. So this is similar to ophthalmology, just that here you need to write a legend and also 150 words about the article. So you need to describe your like a short summary of a case. You need to give that, and then you need to give a small literature review of 2 or 3 lines. Then we come to IJO case reports. That there are 2 sections. One is ophthalmic images and another is photo essay. Uh, in all these short reports, you don't need to write abstract. So again here, maximum only 100 words. The image should be a standalone image that the reader should just look at the image and get what he wants to see and need not go through the legend. So to give an example, so this is a case of traumatic corneal cyst, which is again a rare entity with a fluid line. So again, when we did an AFCT, we could see that line. So this is before, this is after, and then this is an investigation. So when you combine these 3, then you're telling a story. This is just an 100-word write-up for this, describing what was the lesion, how the lesion looked, what we did, and what was a post-op image, with a few references. The next is photo essays, which is slightly more than an ophthalmic image. But here you can write up to 300 words, 4 authors, and 5 images. So if you have a story, if you have a timeline, then you can go for photo essays. So this is a lady with arrow. Her grandchild played with a bow and arrow, got it injured. So we took a CT before removing the arrow. So we took photos of this. So here you add you have a small introduction, then the case, you describe the case, and then you write the discussion. So now coming to the proper case report. So if you have 1 to 2 cases, you write it as a case report. 3 to 10 cases, it is case series. More than 10 cases, you can write it as a retrospective or a prospective study. For IJO, it's 3 to 10 cases. For cornea, it varies. So you should have documentation. Should be a unique or rare entity. You can't write about 10 cases of mature cataract. So then you need to or something that is already there, you found a new finding, or something that is already there, you have developed a new management strategy. So in the original article, we had title, abstract, introduction, methods, results, and discussion. For a case report, it's abstract, introduction, case report, a case description, and discussion. So for IJO, they have a word limit of 900 words. For cornea journal, they have a limit of 3 to 4 pages. Usually it is less than 10 references, 4 tables to figures. So we'll just see how to write a case report with this example. So we had 2 patients wherein a contact lens was placed in the eye for some reason. They forgot that the contact lens was there in the eye. And this first patient came after 4 years. This patient came after 4 months. Both had some whitish or brownish lesion on the contact lens. And when we removed the contact lens, there was nothing on the cornea. And all these things were there only on the contact lens. We sent it for microbiology. Microbiology grew fungus, pigmented fungus. So you have seen this case in the OPD. And you're a PG in unit 1 or unit 2. You have seen this case. You tag along with the patient, come to cornea department. Meet one of the consultants, show this case. It is easy for us to just remove the contact lens and treat the patient and send them home. But we will not do that. You take a picture before the intervention. After that, you do the intervention. Take a picture again after the intervention. And also, if any investigation is needed, you document that. Collect all the pictures, collect all See, the ASOST is in glaucoma department. We never know when that machine will go in for upgrade. For a machine that is there in cornea department, we know we get at least intimated that Pentacam will get an upgrade in this week. So if you need any data, you want to just take it out. Whereas for an ASOCT, if we had taken and if we had not known, then it becomes difficult. Sometimes the data might be lost. So you collect all the data. Then you go and write, like how we write methods and results. We write the case description first, not the introduction, not the discussion. So how you write a case description? Similar to how you write a case summary in your case presentation for a long case. So you present a case for a long case. A patient, 51-year-old diabetic male came with this occupation, with this chief complaints, presented with this. Then this happened. He was treated with this. On follow-up, this happened, and with some negative history. Because when you present a case summary to an examiner, there is an opportunity for the examiner to ask back questions. Here, the reader cannot ask you questions again. They have to write a letter to reader, which many will not write. So you need to think of the reader in mind and what questions he or she might think, and those relevant negative histories should be there. Avoid patient identifiers, patient data, MR number, all those things should not be there in this. The next thing you write is discussion. Usually for a case report, the reader, when we read article, we never go into the discussion part. Whatever I need to learn from that case report, I learn it from that case description or the abstract or the title. That's more than enough for us, or the picture. This is for the discussion part is for the reviewer and the editor to know that you have done a good job, that you have gone through and done a good literature review, and so that it can be publishable. So here, if it is 900 words for IJO, I'll keep 300 to 400 words for discussion. So again, it's usually 2 to 3 paragraphs. The first paragraph, you again summarize and interpret the findings of the case report. Then you contrast your finding. Like in this patient, I saw it was a dermatitious fungi, whereas there was one report 20 years back which was some other organism. And why fungi is more common in our culture, why contact lens is not good for Indian population, something like that. So here, this is the discussion part. So first I started with therapeutic contact lens, its role, then previous reports of colonization, what were the organisms that were seen, what are the risk factors for contact lens infection in India, and this was a case where the contact lens was retained for 4 years. So I also looked at reports of retained contact lens, and then conclusion. So you have written the case description, you have written the discussion, now you go to introduction. The introduction should be small, 100 words, concise. You describe the uniqueness of the case, why the reader should read your case. You attract the reader's attention. Then you go to the most important part, the abstract. Usually for a case report, it's non-structured. Some journals ask for a structured case report. So usually it is 100 words to 250 words. Most of the journals, they keep it only as 100 words. So this is the part of your article that will compel the reader to read your article. So you need to concentrate here. It should be concise. It should be precise. Whatever information you want to say, it should be here. No negative history or very minimal, most relevant negative history should be there. And what you're going to conclude, that should be there. So 2 patients with the colonization of therapeutic contact lens was dermatitious fungi. The first patient had a retained soft contact lens on an opaque cornea for 4 years. So this is something unique. 4 years the contact lens was in the eye, and there was brownish black pigmentation. But when we removed, nothing was there. So that again, both the patients had only conjunctivitis, but did not develop keratitis. And what is the conclusion that we are trying to say? Then you come to the most important part of your case report, it's the title. So when a reader opens a journal and goes to the list of articles, he or she is not going to read all the articles that is there in the journal. So you need to have something catchy, something unique, so that makes the journal to flip from the index page to your article page. So avoid redundancy. So usually the case reports will be given in the subheading of case report. So you need not write a case report of dermatitis fungi colonization. Just write, so avoid that term. So finally, most important thing is photographic documentation. You need not have excellent images. You just need to have clear, crisp image with adequate brightness. It can be a slit lamp photography, or we have Ram Kumar. You can take images with DSLR camera for children, for patients with nystagmus, for patients who are not cooperative. You can use those images. And you need to document it before and after a procedure with the same magnification, with the same exposure. Documentation of relevant investigations. And most importantly, you need to document the follow-up visits. You need to ask the patient to come back for follow-up when you are there in the OPD, so that the documentation is not missed. When you call the patient again for follow-up third time, that either chronologically that finding might have been missed, or the patient will not come back for follow-up. Thank you.